viewers, this is Mumtahina Mahi with you, welcoming you from the world's largest refugee camp. Today, MSF's team have visited the refugee camp. Paul McFinn have visited the Rohingya camp. He have visited this for the first time. He come from Australia. He have visited all the tiny places and all the facilities of Rohingya camp. And now we will talk with him about the facilities, about all the things and all the mission of MSFs about host community and the Rohingyas. Let's talk with them. Hello, sir. Okay, so you have come to Bangladesh and visited refugee camps. So what was the actual aim to visiting here?
Well, for me personally, it's very important that I can have a better understanding of the challenges that are taking place in this refugee camp setting. I understand also that there are many health challenges facing the host community, and we make sure that all of our services, of course, are available to everybody. Free quality healthcare. What I need to do and what I intend to do is make sure that this crisis in Bangladesh does not become invisible on an international stage. It's incredibly important that we work together, and we as an organization will take a commitment to try and address this within the international community and across regional states to try and find longer term durable solutions to this situation, because this situation cannot just continue to stay like this year after year after year. It is already getting worse, and we already witnessed the impact
as we have
of that
visited, like,
in our
this
clinic.
is a very tiny place and tiny hospital, and so many patients, so many populated Rohingyas here, refugees here. So have you thought anything about that? Like, it's a very small for them, like it should get more wide?
Well, as you can see, you said to me earlier, no, it's very cramped, it's difficult to move. It feels very claustrophobic. But actually, that's how the entire refugee camp setting is for the majority of the people living here. The problem we're facing is, we just don't have enough space. Our facilities are overcrowded, as you just saw. We can only do so much to expand, and one organization can only do so much to increase the scope and scale of services. Whilst at the same time, we know that the money pouring into Bangladesh to help the Bangladesh government deal with these problems is reducing. That there really is a risk of a financial crisis, and it's incredibly important that we try and address that these needs have not gone away. In fact, if anything, there are some needs that are growing. So we really need to make a strong call for the international support that's coming to Bangladesh to continue, for this population not to be forgotten, and for us to work together in the region to find longer term durable solutions.
So as we know that MSF works for the host community and also for the refugees.
That's right.
What do you think? MSF is giving more importance to refugees or host community, or maybe the host community are getting less facilities from MSF? What do you think about it?
Well, everywhere in the world we work in the same way. We're very patient focused. We work with what we call an impartial approach. So we identify where the needs are greatest. And I think we could all agree that an influx of 1 million people into a country will completely overwhelm the health services of that country, or at least that location. So it's not surprising that we see a big burden of demand from the Rohingya, and it's normal to have a response to address that. But we equally recognize that the host population has also been overwhelmed. It no longer has easy access to health services either. And we also see many of the same problems that we're seeing in the Rohingya population. We also see in the host Bangladeshi community. So we're trying to address equally the health needs of the population. And instead of us looking at whether you're from Bangladesh or you've just come from Myanmar, no, we just look at what your problem is. Why have you come to this clinic? What can we do to help? And what we see is, in some cases, we're treating about 40% of the local host population and 60% are Rohingya. So it's not who you are or where you come from, it's why you come to the hospital that matters to MSF.
As we know that cancer and heart diseases are really increasing day by day. Like every people, like every young people and old people are getting worse, like this heart diseases and cancer. So we don't have anything like special hospital. So would you like to place some hospital or some doctors, the specialists about the cancer and heart disease? Like these patients are too much.
I mean, I think this is a crucial question, a very, very good question. We already have 8 different programs here in this refugee camp setting. We're already investing $35 million a year. And that's what we've agreed, and the Bangladeshi government has called upon us to do. So we have a very clear agreement about what we will commit. And we are making this commitment not just for this year, but for the years to come. That's very clear. But also what's clear is we cannot do everything. Already the size and scale of our operations is quite enormous. And as you've seen today, we're not really coping as well as we would like to be in some of our facilities. So our first priority is to ensure that what we're already doing we can maintain, and that we can do it at a good level of quality care. Next to that, we see a huge increase, as you have said, of cases coming to us with chronic diseases, primarily hypertension, diabetes, also asthma. So clearly there's a need. So we have set up facilities to try and address these disease burdens. We are treating these people. Many of these cases we can't manage with the capacity and the expertise we have. So these cases we need to refer. So we also have to work with the Bangladeshi Ministry of Health, our counterparts, our medical colleagues, to find a common solution. But yeah, there are limits, of course, to what we can also do as a single organization.
The thing is, like, scabies is just increasing day by day in Rohingya camp. So what have you thought about that?
But now we're seeing the numbers. We saw the numbers from the year 19 to 2020. We're in the region of 48,000. Now we're seeing they're in the region of number of people coming in the past 12 months is almost doubled, 78,000. So clearly there's an explosion, if you like, of skin infections, primarily scabies. And you saw now the number of people sitting waiting to be treated. So treatment is one thing, we can do treatment, but it's the environment that we have to address. It's the cramped living conditions. It's the insecurity of those living conditions, the fact that these temporary shelters are degrading after 5 years, monsoons, rains, landslides. The basic living conditions are very, very hard to sustain some level of dignity and some level of basic hygiene practices. And as a result, we see people with scabies, and it's very hard to address if you don't also address how precarious the living conditions are.
Yeah, as Rohingya people are not that much aware of this kind of sickness and illness, they're really, HIV is also increasing, I think. As they are not aware, like young Rohingya people really don't know, they are not even aware about this kind of sickness. What is HIV, what is scabies, they don't know about it. So don't you think we should do something to prevent this kind of things, like raising awareness, like increasing the number daily? So we need to prevent that. But if we don't, it's going to be a very, very, very big problem, even for the host community.
As we know, in my own country as well, I mean, there are very, very many things where we really need to have a better understanding on a public health level among the general population about the risks that we face in the environments that we live. Here the environment is precarious. There are many risks because of the nature of this camp that you don't have elsewhere. So yeah, absolutely, this exactly what you said, better health promotion, better education, better dissemination of information, and very simple practices, simple hygiene practices, washing hands, having access to clean water, having access to the disposal of waste. All of these things we take for granted, but these are the things that keep us healthy. And here, that's what's a real challenge.
So that was the interview from Mr. Paul McFun. Thank you very much for watching. Stay with TT and stay tuned, stay safe.